Everyone, it's Lisa from Been There Got Out, and we have our guest who I'm sure will be able to get on here really quickly, Dr. Liz Stilwell. She is a psychologist and a forensic expert, and she does a lot with custody evaluation. Let me see if she's on here. Let's see. Oh, I hope this works. Not yet. All right. Anyway, so she actually is a colleague of Dr. Mark Singer, but we have clients in New York who can't use Dr. Singer. So we heard that Liz was really good too, and we figured we would try to get her on, and I don't know where she is. She got on so quickly before. Let's see. I hope she's not having problems. She's an Instagram Live virgin. She's never done an interview, and I'm wondering if that's part of the issue. So if she doesn't get on here in the next few seconds, I think what I'm going to do is just stop it and then find out what's going on with her, because she just popped on for like a second really quickly, like faster than most of our people. No, I don't see her. All right. Anyway. Well, I think we'll probably end this and, oh, no, there she is. No, I'm not going to end it. Here she is. Let me invite you, Dr. Stilwell. Where are you? Oh, no. Okay. This should work. Okay. I was worried.
And I was on.
Okay. All right, good. So I had just said that Dr. Liz Stilwell, we were just on a couple minutes ago making sure that this worked, and I'm so glad that you're on smoothly. And so why don't we get started by you formally introducing yourself and tell us a little bit about your background, and thanks again for coming on today.
Sure, thanks for having me. So I'm a licensed psychologist in both New York and New Jersey. I specialize in forensics, particularly as it relates to family court matters. But I have decades worth of clinical experience working with children and families, which I sort of bring to the table in my evaluations, my risk assessments, my treatment approaches.
Okay. So one of the things that we got asked recently that a lot of people have confusion about is what's the difference between what you do versus there's attorneys for the child, minors counsel, guardian ad litem, custody evaluator, child psychologist. Like, what do you do and which is best? Because someone was just saying, how do I know who to hire for our case?
Sure. So psychologists can play a lot of different roles. So we can be a custody evaluator, we can be the child's therapist, we can be the family's therapist, we can be the parent's therapist, and in some states we can be appointed as a GAL. So it depends on the role that the doctor is assigned to in your case, ordered to how you select for that individual to be involved. When a psychologist is a custody evaluator, what they bring to the table is, years, decades of understanding of child and family development, but then a specialization in forensics and in family court. They can give objective opinions regarding what's in the best interest of the child, and that's typically done after a comprehensive evaluation of the child and all the family members, collateral information. It's a larger scope than what a GAL's report might be or where their recommendations may come from.
So like a GAL is not necessarily a psychologist?
No, a GAL can be really anyone the court appoints that they feel is qualified. In different states, they tend to lean towards different types of providers. So they can be attorneys, they can be mental health professionals, they can be psychologists. It depends on the state, depends on the judge.
So there's no regulation with like a guardian ad litem?
There is.
There is? Okay.
Yeah, the person requires specialized training. They have to be deemed by the court. So there's a very particular training that they have to do and certain competencies they have to have, but they don't have to be a psychologist.
Okay, but it sounds like a psychologist definitely has a lot more insight, like you said, into the development of the child and all what's going on with the family.
Yeah, so all psychologists are trained primarily, like initially primarily in what we call clinical work. So focusing on child development, we train in adult development, family systems, and it's a broad sort of psychological training. When a psychologist decides to start to do custody work or to get involved in family court matters, they have additional specialized training, really in the area of where all of that mental health training intersects with the law, and particularly the family law in the state that they're working in.
Okay. Now, what about like someone who's an attorney for the child? Their goal is to represent the interests of the child, right? Not necessarily best interest, or is it similar? Because I'm asking this because I recently went to this, the 2022 Family Law Conference in New York City, and there was an attorney for the child, and he was explaining that he does the evaluation, but he works with social workers because he doesn't have that psychology background. And I know a lot of audience members were saying, wow, we wish we had other people who are minors counselor or attorneys for the children who did involve social workers, because people who are attorneys for the child don't necessarily have any training in psychology either.
Correct. So sometimes GALs or guardian ad litems will consult social workers, psychologists, because there is a certain skill set that the mental health professional brings that an attorney doesn't have. That attorney is assigned, and again, I want to note the difference between a GAL or a guardian ad litem who's appointed in a child protective matter versus a GAL who's appointed in a custody matter. Both of their roles are to make sure that the child's voice is being heard and that the child's being represented in court. Their focus is the child, that's their client. Of course, they interact with the parents and the other parties, but they're there really to make sure that the child's interests are being addressed and best served.
Okay. All right. That makes sense. Now, you mentioned when we first spoke, you do something called structural family therapy, and you said it's kind of like a boundaries approach on steroids. So talk about that, because we love boundaries.
Yes. So structural family therapy has been around for a long time. Salvador Minuchin was the psychologist who really pioneered it. And it's an approach that looks at the dynamics between and among family members. It literally looks at the structure of the family and says, how are they functioning, right? Typically, the first couple sessions start out with mapping out the family history, the family dynamics, trying to understand where the problems lie. Traditionally, the therapy was developed to help to treat a child or an identified patient's symptoms and understanding it within the context of the dynamics of the family. What about in this case, a child's environment is maintaining, promoting, disrupting their development? And over the years, that's been applied to families who've experienced high conflict divorces, separations, because that boundary and structure changes. And so the therapy approach really looks at, what the parents as a unit, the incorporation of step parents or co-parents or other sorts of partners, the relationships among and between the children, and sort of as a checkup and a reworking through that those boundaries are healthy and appropriate to promote the child's development.
Okay. So another thing that you mentioned was that you have this unique approach when you deal with families. Of when they decide to participate in the process. Do you remember what you said about that?
I think
you tell clients and why.
I think you had asked me about reunification therapy or family therapy within the context of divorce and custody disputes.
Right.
And my process is that the entire family system needs to be involved. And when I say involved, I mean involved with me. They're not all getting in a room at the same time. That determination is made case by case. But all of the parents, all of the kids involved, all of the important caretakers in that child's life or children's life participates in some degree, with the understanding that this is a family problem. I can't address even if it's the referral is to address the relationship between one parent and the child, the other parent, the other caretakers need to be involved as well.
Okay, and that goes into a question that I saw up on the feed already, which I knew we were going to get, is what about when there's false allegations of, or just allegations of
Yeah.
parental alienation? That word, we know is very provocative, but when someone's saying, basically, I'm not talking about parental alienation syndrome, I'm talking about somebody saying, this person, and Mark Singer also clarified this, Dr. Mark, the other week, when one parent claims that the other parent is having the child reject them or try to erase them. So they're saying, you're alienating me from our child. How do you deal with that? In the same way? We just get them all together or
No,
talk to all of them?
no. When cases are referred to me, there's an intake process, and I'm meeting with everyone individually. Some cases come to me having already gone through an evaluation process, right? They've met with experts, the abuse and neglect has been investigated by Child Protective Services, or there has been some sort of determination made by the court, or there have been evaluators or a single evaluator who's looked at these allegations. If I do the intake and feel like, whoa, hold on here, like there's too much gray, there's too much uncertainty about the validity behind these allegations, I may refer the family back to the evaluative process before we start. Because as acting as a therapist in that role, I need to know what I'm working with. I need to know that I'm not doing more harm by perpetuating allegations. So we want to know, to the degree that we can, what's going on with the allegations, what's going on with the resistance, to try to understand what we're going to be treating.
Okay. And then I know another thing you had said, well, actually back to, I think you started saying it, is when people sign on with you and they're all participating, that they have to basically listen to what you recommend, right? They can't just go off and do whatever they feel like. To choose what works for them, right?
So they have to agree to meet with me, right?
Right.
And they have to, I hope that they come to the table with an open mind and in trying to figure out how we might do something differently, because things haven't been working, right? If things were working, they wouldn't need me.
Right.
In terms of what they do outside the session and when they're home, I don't have control over that all the time. I can advise what to do, but I also understand there's not a single approach for every parent or every family. So it's really important that whoever you're working with works with all parties involved and really tries to customize the treatment to that family.
Yeah, and it sounds like you really get to know different people in the family.
Yes.
Okay. And another thing you said that stood out to me was that during a divorce, kids see that the environment has changed and that you are affected, meaning you, the parent, are affected. Can you elaborate a little bit more on that?
Yeah, absolutely. I echo it to my clients all the time. No matter how good of a job or how hard you try to keep the child out of the conflict, not exposed to the court proceedings, inherently their world has changed. And they're trying to make sense of the change, and they're trying to make sense of what's happening in the world. And it can be a very emotionally trying time in a parent's life, and that impacts them. Your kids pick up on that. And it's important to address it with them and not pretend like they don't see it or they're not exposed. Their kids are really smart. They see and hear things, even if they don't see the whole information. They're picking up on that. So it's important to check in with them to see where they're at and what they're thinking and what their concerns are.
Yeah. And now the big question that I asked you, that I try to ask everybody, and I asked it in our Instagram this morning, is why do you think a kid might align with a parent who might not be the healthiest one and start turning against what we often refer to as like a protective parent?
Yeah. It's such a complicated question.
I know.
It's such a complicated question. Again, it's why it's so important that the professionals working with the family really take the time to get to know the parents, the child, speak to collaterals to try to figure out what might be going on. There's not one answer to that question.
Okay. Well, I want you to mention, you had said kids choose the path of least resistance. Can you elaborate on that? Because I thought that was fascinating when you mentioned it.
Yeah. So imagine you're a child and you're faced with like a very emotionally challenging situation. Kids don't have the same capacities. I mean, even adults don't desire to jump in and sort of tackle these difficult feelings. So a child may choose to just acquiesce to both parents, not assert their preference, not talk about their feelings, take on more of a go with the flow kind of approach because it's emotionally challenging and difficult for them to try to assert their position and tolerate feedback that they get. They may feel guilty. They may feel like they are causing more problems. And so oftentimes they will sacrifice their own position or their own desires. And again, it's why it's so important to be aware and check in with your child as to what they're experiencing, what they're going through, how they feel their voice is being heard or not heard.
Yeah, and as we're talking about this, I'm thinking that with a number of people, we see kids who shut down, and then one of the parents will say, I feel like my kid is not loyal to me, or they're not standing up to the other parent, and it's hurting me. Is there any advice you could give to people who are taking it personally when their kid is sort of going along with the other parent?
Yeah, it's a big topic in therapy. It's a big topic I work on with my clients, and how to separate your feelings as the parent from that of your child, and to be able to hold your own feelings in mind while giving your child the space to process what they're going through. And again, I think it's so important for especially the parents who are with me in family therapy. I always recommend they have their own therapist. That they find a space to work through those feelings, because they need to come to a place where they can contain their own affect so that they can be present for their child. And that just goes across parenting in general. We have to regulate ourselves as parents so that we can be present for our children. And that task becomes increasingly difficult when you're going through a divorce or there's conflict within the family.
Yeah, for sure. Okay, so then we got a bunch of questions that I've been putting together on a list to ask. So one person was saying, how do you deal with it when it's one person's parenting time and the other person keeps appearing at events where the kid is doing something like a sports game or something, and then it's really uncomfortable for the parent whose parenting time it is. Like they go up to them and start talking to them. Like, how is it for the kid, or what is there anything one parent can say to the other? Because it is affecting that parent, and then the child feels like he or she is in the middle.
So tough, really tough situation. And again, it depends on what the agreed upon parameters are regarding parenting time. If something is affecting one parent or both parents or the children, it warrants a conversation about boundaries and compromise, which is inherently difficult in a lot of custody cases. But is there a way that they both can be present if it's important for the child to feel like both parents are there, they're both supporting me, they're having a unified front, but there can be boundaries that are maintained so that both people can feel safe? It may warrant a response of, now is not the place and time. I want to hear your concerns, but there's another forum that we can do this in, right? Redirecting to whether it's email or some type of app you use for communicating, but again, with an eye towards reducing the conflict that the child's exposed to, right? Ideally, both parents are putting the child's needs first.
Yeah. Okay. Another thing that, again, the whole, let's see, actually, I'm going to switch it. So I forgot to, I don't know if we talked about your title. Are you also a parenting coordinator?
So I don't do parenting coordinator.
Okay. All right. So in the context of what you do, say when you meet with a family, do you care more about the history, like a lot about the history of what's already happened? Or is it some history, but more of like a solution-based moving forward sort of thing?
So I always say I'm a glutton for records.
Okay.
I like to have the history. I like to know what this family has been through, right? From where have they been? What has happened prior to them coming to me? That helps me to conceptualize and understand, or attempt to understand the best I can, what's brought them here today. The focus of the treatment isn't always to rework through things in the past.
Mhm.
I won't know if that's an appropriate treatment goal or not unless I know what the history is.
Okay, so in terms of the history, do you look at things like court stuff, like divorce documents and motions and very specific things, or is it more like the history of what people tell you?
Both.
Both. Okay. All right. Another thing is because you know that a lot of the people who are watching this and will watch it are dealing with domestic violence. They often want to be separate, and it sounds like you do speak to clients separately, right? You don't try to. Okay. All right. Yeah, because I know that one of our clients said that when she's around the ex, she feels like she shuts down and gets bullied and railroaded. So that's why it is really helpful. So I'm glad to hear that. Okay. Here, this is a little trickier. One of our, and I'm just going to read from it. So one of the viewers mentioned that there's been studies shown that false childhood sexual abuse allegations are very low, but when another parent denies it or claims parental alienation as a defense, it muddies the waters. And there's the whole Allen versus Farrow documentary with Woody Allen and Mia Farrow. So this is another big question, but what's your opinion on all this where there's like sexual abuse allegations from a child and then the other person says, no, this is parental alienation? And is it okay for me to ask you this question even?
Yes, because it's a topic we discuss as professionals all the time, and is an ongoing conversation in the professional literature. So I think and I apologize to the audience if I get really technical with this answer, but there's sort of two bodies of research that answer that question. There is the literature of what we know and don't know about allegations of sexual abuse and false allegations of sexual abuse. Layer on top of that false allegations of sexual abuse within the context of a custody case. Social science is inherently difficult to research, particularly information that's protected. So the research studies that we have, we're fortunate to have them. They may not be as robust as we think that they are. So we really want to look at where that data is coming from, how strong is the data, and what we can take from that as evaluators, what we know, what the literature says, what the research says, and be sure that there is a comprehensive evaluation of the allegations, right? That's one whole specialization within forensic psychology, is the forensic evaluation of children making abuse and neglect allegations. The other part of it is that there's been studies that have come out recently that say, when allegations are brought up and then there's counter allegations of whether it be parental alienation or coaching, that it, quote, muddies the waters. And actually, when there was another study that did a deep dive into that data, and now it's sort of, the results are inconclusive. So even as professionals, and when we look at the literature, we say, well, there's limitations to what these studies are saying. So what do we do? And my answer to that is you get competent, comprehensive professionals to look at all the possible hypotheses of what is going on. And that expert needs to be somebody who can clearly state what we know and what we don't know, the limitations of the research, so they can advise the judge. That's ultimately our job, is that we're support to the trier of fact. And we need to be open-minded to many alternative hypotheses that can occur. And we need to be aware of our limitations as experts.
Yeah, it's so tricky because we've heard such a range from different people in professionals in different countries where certain professionals we've talked to in America will say, and I'm thinking in particular like a New York custody evaluator who said that children under a certain age don't have what's called swearability, that because they're so young, their story changes all the time, and that as it's almost like the more they get asked, the more elaborate the story becomes, so it's really hard to tell. Then we talked to an attorney for the child in Canada who says, well, children are the least likely to lie, so why would they ever make up something like that? So how do you deal with completely conflicting things with like a young child versus an older child? And
Yeah, it's why it's so important that the people interviewing the child have the training and expertise in this area. It is having a degree in psychology or having a mental health degree is not sufficient. There's specific training protocols in child forensic interviewing. People need to stay current with their continuing education, current with the literature, because it is so difficult. I would say that, both things you just said can be true, but are they absolutely true for every child in every circumstance? No, because every child is so different. 4-year-olds developmentally can be on different ends of the spectrum. Throw in language delays, throw in learning delays, throw in high conflict, and now you need to really understand the whole picture that child's bringing to the table. And an expert in that area is going to understand all these dynamics that need to be looked at when coming to a conclusion about the validity of a child's statements.
okay, yeah, I mean, it's so complicated. And so speaking of that, I mentioned that I was at this family law conference the other week, and there was a 20-year-old woman who told this awful story about how she had been abused by her father, and they really pushed for reunification camp, and that she and her sister were kidnapped and put into this camp that caused more damage and trauma. And so I was going to ask what your views are on these reunification camps versus reunification therapy versus leaving it up to a child to decide whether they want to reunite with a parent. Of course, that's a huge loaded question too. Sorry.
It's okay. First of all treatment programs are created differently, and the circumstances by which a child is brought to a program, forced into a program, is all different. I've heard stories much like the one you just shared. I've heard other stories where sort of immersive experience has led to good outcomes. My understanding, and usually typically my recommendations in cases where reunification therapy comes up, is again that assessment. How is it going to address this family system? It is blanket recommendations aren't appropriate in every case. So what are the dynamics? What might be done? How might we address it? Reunification therapy is typically an outpatient therapy, right? Once a week, come to the office. Do they need a higher level of care? Do sessions need to be multiple times a week? Are there other things that we can do? Or do they need this immersive experience of going to a camp? And if they need that level of intensity, what is the program offering? What are the protocols around it? What harm might come to the child? Again, these are all such unique questions to each family and each scenario. Because as you described, the child's experience, but oftentimes children don't feel they have an input in the decision-making process. And so the collaborative approach is really important before you make that decision. It's not going to have the same outcome for every kid because they're going to experience it differently.
Yeah, and speaking of that, I'm thinking one of the big concerns with this community is always saying that they want the voice of the child to be heard. They want, is there anything you can say about, besides what you do in having the collaborative approach where different people get to speak to the child? Is there any other suggestions you have for someone to make sure their child's voice is heard?
Yeah, I mean, I think it's important for the child to be able to speak sort of clearly with professionals, like the right professionals who can understand them. Sometimes judges will speak with kids, sometimes they won't. It seems to be a decision on a judge by judge basis. But getting the child in front of a provider who understands their development, understands their dynamic, and can document that and explain that to the person or people who are ultimately making the decisions is, you know, a really good way to advocate for them.
Okay. All right. And then is there anything else you can think of? I'm at the end of my questions. Anything else you can think of that maybe to comfort someone through the process or point them in the direction? Because I know you're often dealing with like angry people all the time who don't want to have a third party making decisions. Like any tips on finding a good person to evaluate, like things they should look for?
You know, I think talking to the professionals who are going to be involved with your family, asking the concerns that if you have any upfront, asking what their experience is with high conflict, you know, getting an understanding of what their theoretical orientation is, what their training is, what they're bringing to the table, and if it fits your family and their needs. Does the person have specialized training if in risk assessment, in domestic violence, in child abuse, in allegations? Making sure that that person understands and has that framework before they start working with your family.
Okay. Yeah, that's great. All right. So thank you so much, Dr. Stilwell, for, sharing like some background on all of this. And I did finish all my questions on time. How can people find you if they want to get in touch?
So we have a website, the westessexpsychology.com. You can find myself there and my colleagues there, and there's a way to contact us through the website.
Okay, great. All right. And then you have a brand new Instagram handle, so that's in our description, and they could just maybe find you that way too.
Find me that way as well.
Okay. Thank you so much.
You're welcome. Thanks for
I'll
having me.
talk to you later. Okay. Bye.